Thank you so much, Ava. And everyone, continue to put your name and info in the chat. What's up, Utah? Someone from Utah is on here. This is so exciting. I always love seeing that, knowing that the spirit of volunteerism at Community Health goes nationwide. So I'm really excited to be here tonight to chat with you about our new strategic plan. So Community Health, the last time we did a strategic plan was in the summer of 2020, if you can believe it. And what a time to be alive and to be doing strategic planning. So we were really thrilled this strategic planning time around that we were able to do the planning not in the midst of a global emergency and pandemic, and really be able to focus on some exciting strategies and growth. So this was a 6-month long process to complete our strategic plan. It included work groups that comprised of staff, of board members, and also of associate board members. And then ultimately, the new strategic plan was presented to our board of directors in September and approved. And so let me tell you a little bit about what's in the plan. If we could go to the next slide. So our strategic plan has 4 themes that are essentially like goals and focus areas for the plan. So in the next 3 years, we are going to have an expanded access of care delivery model. We're going to continue to advance our community engagement and outreach. We're going to focus on our workforce, which includes not only our employees, but also all of you, our amazing volunteers. And then we're going to make sure we can pay for stuff, because that's a really important thing. But as I'll get into later in the presentation, I think we've got some really exciting and innovative tactics around funding the mission. So we have 4 key themes, 4 key goals. And underneath these 4 key themes and goals, we have 6 strategic priority areas. And if we could go to the next slide, I'm going to talk a little bit about those. So these strategic initiatives, I'm excited to say there are 6, and they are ambitious, but I will add our last strategic plan had 9 that were also very ambitious. So this is feeling exciting and manageable. So I'm gonna actually read each strategic initiative and then tell you a few of the tactics that are in each of these initiatives that I think you'll find very interesting. So our first initiative is to expand our footprint and strengthen services to improve access and the patient experience to support continued high quality care. And so what does this mean? I mean, we're all in favor. This is fantastic, but specifically some things that we'll be doing in this strategic initiative include opening new microsites. So expanding that model of care. Shout out to all of our microsite volunteers. This is a model that we have been able to demonstrate works. It improves access. Patients have a wonderful experience with you all, and that we get really high quality outcomes. And so we will be not only opening new microsite locations, we'll also be expanding at least one of our existing locations, Community Health at Onward House in Belmont-Cragen. So in this strategic priority, we are also going to be not only expanding our footprint, but we're also going to be deepening our services at Community Health with a specific focus on expanding mental health services, dental services, and then continuing to refine our pharmacy availability. And finally, we know that the populations in Chicago continue to change, and we want to be sure that we are being responsive to those changes. So we'll be exploring the need for additional language access possibilities. So our interpreters on the call, as you know, we are covered in Spanish and Polish, but we're going to explore if there are other language needs that we want to make sure to establish and set up. I think that Community Health, I've worked in safety net healthcare my whole career. I think we do an exceptional job at language access in particular. Our materials are always spot on. Our interpretation is always spot on. And that's not necessarily the case everywhere, where you're making sure that all of your materials are in all of the languages of your patients. So when we do this, we want to do this with intentionality and really be thorough with it. So we're very excited about that. Now, our second strategic initiative is to increase engagement in targeted communities to promote access and trust. So one of the areas that we invested in the last strategic plan was in community engagement and outreach. And what that has really meant is in the last year, we've actually seen, I think, a close to a 48% increase in new patients. And only about half of that is accounted for because of the migrant crisis. Around the other half is because of the expanded outreach and community engagement efforts, which means we're meeting more people who need our services. So we're going to continue to deepen that. We're going to continue to invest and train our outreach workers, hopefully grow that department as well, so that we can continue leaving our four walls when we're providing care and outreach to our communities. One other area that we're going to focus on is we have a current patient advisory council. This is a fantastic group of really engaged patients who, for example, they were engaged in the strategic planning process. Some of the tactics that were developed in this strategic plan were ones that they specifically asked for. So they're highly engaged, but unfortunately at this time, we're only doing it in the Spanish language. So we've got an opportunity to expand that patient advisory to all of our patient populations, and to also rethink how they report up so that they can create greater connections to myself and other leaders at Community Health, but also directly to our board of directors, so that we're building that patient experience, that patient lived experience at Community Health into key decision-making and governing decisions. Our third strategic initiative is develop new and innovative funding approaches to build sustainability and drive growth. So something about Community Health, as you all know, is that our mission is funded through dollars, of course, but it's also funded through donated goods, such as our medications and lab services, and donated services like y'all. And so our volunteer services team has done a remarkable job at continuing to grow our volunteer base, and we will certainly continue to do that. But we're also going to be looking at new ways to do what we call friend raising. Community Health has, for 30 years, had some folks who have been supporting us like since inception, since the beginning. And we want to make sure that we're keeping an active pipeline of donors, friends, and supporters. So we're going to be engaging in some active friend-raising activities, advanced donor stewardship, and then we're also going to be looking into how we can look to our alumni volunteers and how we can keep them engaged after they've moved on from their tenure at Community Health. And if folks are familiar with structured fundraising efforts in healthcare, there's often the grateful patient model. So this is the concept of the grateful volunteer model as well. And then we are also in strategic initiative 4, going to cultivate a workplace culture of growth and inclusion. And again, this is our workforce development, which includes you. And some key tactics in this space include professional development opportunities, and identifying what those are, prioritizing what they may be either for our workforce or for our volunteers, and deploying that over the next 3 years. And, I feel like the Vols team has already started to do this quite a lot in general, but I think during the pandemic, obviously things changed a little bit and they've been really picking that back up, which has been fantastic. And then we are also, pardon me, I'm going to continue to advance our DEI initiatives. Community Health has a very active DEI council, who I think, especially in the last year, 1 to 2 years, has deepened how they operate, including making goals, reporting directly to senior leadership. And we're going to continue to invest on that. And I know that there'll be some more about that coming up later in the presentation. And then we are also always committed to internal growth in the organization, which includes with our volunteers as well, And, I also do like to brag that a significant portion of Community Health's employees were volunteers first. And so there is that pipeline for you all as well. And I know the team keeps you included in that. But certainly, as you're thinking about your own professional goals, know that Community Health wants to continue supporting the ones you have now and the ones that you have in the future. Our fifth strategic initiative is to diversify and support strategic partnerships that amplify our mission's impact. Partnership is a pillar in our business model and in our operating model at Community Health. So we'll be looking to strengthen our existing partnerships, grow new partnerships, including for in-kind services, but also we want to elevate the brand awareness of us and our partners together. For example, I guess this comes up in the strategic initiative 6, but I'd like to talk about it here too, which is our secondary mission. I was talking to Gloria the other day and I asked her, how many medical education and training programs do we work with? And she rattled them off really quickly. I had a funder meeting and I just wanted a rough estimate. And when she told me, I almost fell off my feet that we work with 16 programs. And that is very unique. Other places in the safety net, they'll have their one program, or maybe they'll work with 2 programs. But our secondary mission is really to invest in the future providers that will be caring for our communities, for our families. And I think we do it in a really unique way. And that's an example of something we could really be highlighting in bigger and broader ways, which I'm really excited about that one. But I did kind of spoil strategic initiative 6 a little bit because technically that tactic is in that one. But to elevate our role as an integral part of the healthcare network and advocate for under-resourced communities. That secondary mission piece is a phenomenal role that we play in the ecosystem and one that we don't talk about enough. And I'm really excited to be talking you all up. I think the other piece of this that Community Health has done in the last 2 years especially is really grown our role in advocacy, to really serve as a voice for the issues that impact our patients and our communities. And I would say one of the ways this is already manifesting is in the current migrant crisis and the tables that we've been sitting at to ensure that, for example, when you all have gone out to the precincts and provided us with feedback on what you're seeing, on ideas, on solutions that could be implemented, we're taking those directly to the tables where decisions are made. And so know that if you've shared information, we have absolutely used that to uplift your voice and uplift those solutions. I think one of the ways that we could also frame this is that Community Health is trying to grow its role in being known as an authority on health equity. Just yesterday, or 2 days ago, I was having a conversation with someone where that kind of came up, and I was able to really reference equity from the lens of where Community Health sits and the populations that we serve, immigrant communities. And so we're going to continue to grow that. We've been very active in the local and state level, and we are looking forward to the opportunity to grow that deeper in those spaces. And then, of course, better understand how we can become an advocate at the national level. And so I think that's a key highlight of some of the really exciting things in the new strategic plan. I appreciate the ability to share. I know there's opportunities for questions later, and I look forward to having a chance to respond to those.